Hello fam, I'm still your girl Annie Otta. I want to talk about mental issue. Mental issue is a very important topic that every one of us needs to pay a very close attention to it, especially at this time in the world. So the topic I want to discuss today is what we call bipolar disorder. In our local terminology, Ishimbaka. That means something abnormal is going on in the brain. Bipolar disorder is a very serious mental health condition that causes extreme shift in mood. That means mood swing. There is intense or extreme changes in energy and behavior. Sometimes this situation often appears in late adolescence and early adulthood. Nevertheless, the symptoms can start at any time in anybody's life. Bipolar disorder can be experienced in two different ways. That means manic episode when the person is very high, or in a depressive episode when the person is very low, in low mood. So this episode can last for hours, weeks, months. There is episodes of psychosis. That means your thoughts and emotions are disconnected from reality. In this manic episode, that means when the person is in the high, the symptoms are increased energy and activity. This person has a whole lot of energy. There is irritability, there is restlessness, little or no sleep, irrationality. That means the person's judgment is impaired, inability to sleep or fall asleep. There is reckless behaviors. The person is behaving anyhow without thinking about the consequences. So this person have more and more activities going on. This person is not safe to himself or others around. A whole lot of self-confidence above the roof. This person is very talkative, and when they are talking, they will jump from one topic to the other. They cannot stay on one topic and have a decent conversation with you. So this person makes a whole lot of poor decisions during this manic time. Another episode is what we call depressive episode. That means the person is in the low mood. There is low energy, there is fatigue, low activity, feeling of hopelessness, feeling of worthlessness. The person is not able to complete any activity or task. This person has a reputation of thoughts to commit suicide or to do some terrible things or thinking about death. So again, this person feels empty. This person feels sad. This person is tearful. This person is losing weight. Between this high energy and low energy, there is what we call hypomanic. That means this person is in between. Not too high, not too low. This person is just in between the episode. Mixed episode, high, low, in between. In all of this, there are delusional thoughts going on. That means that person is holding so strong to false beliefs, things that are not truth. And there is also hallucinations. This person is having these false perceptions. Either they are hearing things, they are seeing things that are not real, that are not there. There is anxiety going on. There is psychosis going on. There is schizophrenia going on. So this person is hearing voices and seeing things that are unreal. Nobody else is seeing it, nobody else is hearing it, just that person that is having these issues. What are the causes of this bipolar disorder? Number one, genetic issues. That means it runs in your family, it runs in your blood. Either your mother had it, your father had it, your siblings. That means immediate first generation relatives, immediate relative. Number two, non-genetic. That means environmental influences, stress. Something is very stressful happened to you, something traumatic happened to you. Maybe the person lost a loved one, somebody so dear, or maybe loss of job or loss of business, but something traumatic, stressful happened to that person's life. Another one is substance abuse. What are you taking? All these illicit street drugs. You can see a lot of young people going crazy. Those are the things they took. Drugs on the street, they take it and it runs their brain chemistry haywire. They run crazy. They will develop bipolar. Alcohol, how much are you drinking? Alcoholism can also trigger bipolar. Another one is traumatic head injury. Maybe there was accident or somebody hit somebody on the head or anything, something happened to the brain. Traumatic injury to the brain can also trigger bipolar. Another thing that can trigger bipolar is brain structure and function. That means the imbalances of chemicals in your brain, the neurotransmitters such as dopamine, serotonin, and norepinephrine. So the imbalances of these chemicals in your brain can also trigger bipolar. Other potential influences are seasonal changes. When the weather changes during summer, rainy season, dry season, you see somebody going crazy. It will just change the atmosphere in their brain chemistry and it will trigger bipolar. There are situations like that and it varies. What can we do when there is a situation of bipolar? Please pay attention to the warning signs, everything I have discussed previously, and the type of lifestyle you are living. Pay attention to them. Examine yourself. What are you doing that can potentially mess with your brain? What are you eating that can potentially mess with your brain? Think about it and try to avoid such situations. Number 2, are you sleeping enough? So sleep deprivation can also imbalance the chemistry in your brain. The chemicals in your brain will just go haywire. So please make sure you're sleeping at least 7 to 8 hours on nightly basis. If you work night, please compensate and sleep when you're home. Number 3, stay away from drugs and alcohol. These are strong triggers of bipolar, especially if you have a low tico in your lineage. Be careful. Number 4, if you are taking any prescribed medications, please stick to the prescription orders, directions, the way the doctor asks you to take them. If they say 1 in the morning, night, or anytime, please read the labels very, very carefully. Ask questions. Do not take your medication anytime, anyhow. Stick to the doctor's directions, please. Number 5, record, chat, write down any mood you're going through. What is happening in your life? Write it down. Are you feeling this way? Feeling sad? Feeling happy? Talking too much? Those changes going on. Write it down somewhere. When? How? What triggered it? The date? Write it down because you might need this later. If anything is going on that you feel like, this is abnormal, please write it down. Number 6, consult a qualified mental health care provider, a professional, a psychiatrist. Go and see one. Once you sense that something is not okay upstairs, or your loved ones is not okay upstairs, or a friend is not okay upstairs, please consult a mental health professional, a psychiatrist. When you go there, disclose everything. Did your boyfriend abandon you? Your girlfriend left you? Or you lost money? You lost your job? Your marriage broke down? You lost someone? Are you pregnant? Whatever is going on, please, when you see a psychiatrist, be honest, disclose, because this will help narrow down the problem and also help to create and plan your treatment strategies. Number 7, there might be medications involved in your treatment plan. So if the psychiatrist ordered a mood stabilizer, antipsychotic, antidepressant, anti-anxiety medications, please stick to it. Sometimes it might be 1, sometimes it might be 2 combination. Whatever the psychiatrist ordered for you, please ask questions, Get educated about that medication and take the medications exactly as ordered. If you happen to have any issues, maybe the side effects are unbearable, they are making you sick, or they're making you have suicidal thoughts, please consult your psychiatrist again so that they can adjust the medication or put you on a different one. But you got to be open and communicate accordingly. Number 8, certain psychiatric issues, disorders might need hospitalization, either fully or partially. But again, be prepared. Loved ones, be prepared. Some of these episodes might need a very close observation. Be prepared to support your family member financially and physically, emotionally. Be there. Some people might opt for prayer houses. Please make sure that you go to the right place where your loved ones will get adequate professional care. Number 9, professional therapy, psychotherapy, talk therapy. Number 1 is cognitive behavioral therapy, CBT. Number 2, psychoeducation. What is going on? Do you know what is called bipolar, schizophrenia? Number 3, family focused therapy. That means the people taking care of this person, they need therapy too, because it's not easy to take care of somebody who have mental issues. Otherwise, the caretaker might also run mental. Please don't forget to take care of yourself, your own mental health status when you are taking care of your loved one's mental health condition. You need therapy too. You need counseling. You need support. You need prayers. You need talking. You need somebody to encourage you. Please, if you see anybody in this situation, don't just pass by. Be a pillar of support. Support doesn't mean that you have to count cash. Just your words of encouragement, bringing food is also a very, very important way of being supportive. Number 3 of this therapy is what we call electroconvulsive therapy, ECT. Should in case you have anybody in this situation or this situation runs in your family, be educated, be enlightened. It's not a matter of God forbid. I'm praying against all generational curses, generational sicknesses, the Egyptian sicknesses. You're praying against binding and casting and all that. Those are important. Don't get me wrong. I'm a strong believer. But again, there are things we need to do as human beings. So if it runs in the family, it runs in the family. And guess what? Nobody knows who is going to be a victim of this genetic circumstances, genetic issues, hereditary issues. It peaks randomly, not in any sequence. So that's why we need to be supportive of each other. That's why we need to look out for each other. If your mother is still alive today, your father is still alive, or your grandparents, ask questions. What is in my lineage? What runs in the family? This will equip you better. Some of these things are genetic issues, or maybe something along the way like drug, alcohol. We need to be well educated. That's all I want to discuss with us today, and I will be dishing out more and more information on things concerning us and our family members. Please follow me, like, share, and comment on my videos. Stay tuned. Bye guys. Mwah.